Hi, I'm Dr. Kyla, paediatric dietitian, fussy eating specialist, and mum of two. I'm the founder of the online Mealtimes memberships that help parents just like you experience a confident and guilt-free way of feeding children. I'm also a business owner, a hot cross bun lover, and my superpower is finding things that you cannot live without. In this podcast, I'm talking about feeding your family, along with a random selection of topics that tickle my fancy. Welcome to Mealtimes with Dr. Kyla.
Hello and welcome to today's episode of the podcast. My guest today is Dr. Arthee Yogendran, Women's Health Specialist GP from FitRight HQ, a centre for women's health here in Perth, Western Australia. Dr. Arthee is passionate about providing woman-centred care, which I think a lot of us miss out on when we're busy caring for younger or older generations around us. Sometimes our own health can take a back seat, which really isn't helpful. So welcome to the podcast, Dr. Arthee.
Oh, thanks so much for having me, Dr. Kyla. I've been a big fan of yours for a long time, mostly since my oldest started solids, and you helped me through that journey. So thank you for everything that you do.
Oh, that you are very welcome. And it's interesting. I used to be really terrified of working with doctors or GPs and kind of helping them with feeding their kids. But it's such a thing, isn't it? Like everybody has their specialty, and yours is kind of women's health. It's not necessarily feeding children. It's not necessarily different things. And so I'm really thrilled to have you here to talk about something that you probably see in your clinic a lot. And actually, there's quite a lot of things I'd like to talk to you about, including the menopause conference that you went to last week. But today we're going to talk about iron. So this chat came up because I had a recent iron infusion and I had so many questions from my audience, and I think questions that needed more of a deep dive than I could give to people in my DMs. So just for context, for Dr. Arthee and for you listening, my iron levels were pretty great during my younger years. Through my first pregnancy, actually, I had no issues with my iron levels. But since my second pregnancy, they've been hovering pretty low at levels consistent with iron deficiency. I've also had pretty consistently heavy periods over the years, meaning more blood loss and more contribution to low iron. So I'm really thrilled to kind of talk to you today about iron deficiency, all of the things. Why don't I throw to you straight away? Tell our audience, I guess, about iron, why it's important, how you get it, what it does.
Okay, so iron is very important for us. The iron is helpful in terms of helping us to transport oxygen around the body, in terms of our red blood cells. Iron is really important in terms of helping us with growth and a whole host of other things. And in terms of how we get it, we've got a few different sources. So with that, we've got heme iron and we've got non-heme iron. And so, often I have people coming in saying, oh, look, I'm vegetarian. Of course, my iron is low. It doesn't have to be. You don't have to be walking around eating lots of red meat to have enough of an iron source in your diet. Obviously, red meat does have a reasonable amount of iron in it, but there are some great resources out there, and one of the other sources of iron that we have are non-red meat based foods, so things like chickpeas, obviously your green leafy veg, wheat bix. There's a whole host of things, and so trying to have a range of those in our diet is really important.
And I would say lots of women, particularly are trying to get enough iron. Some of them do have reasonable amounts of iron in their diet, and yet they're still showing up in your clinic probably with low iron. How would these women know if they do have low iron? What are you looking for?
So commonly people will say that they're feeling tired. With that, so that definitely is one of the more common things that makes people think about their iron. Otherwise, common symptoms that people can have, sort of difficulty with concentrating, finding that they can feel a bit short of breath. Sometimes people kind of sort of talk about brain fog, especially in the sort of perimenopausal space. And then we find out that actually it's sort of a low iron. So there's a range of symptoms, and some people have no symptoms at all. Sometimes when we're doing a more holistic screen, we realize that people have had such low iron for such a long time that they've almost got used to that being their new default.
Wild, isn't it? And a lot of those symptoms kind of correlate with motherhood too, don't they? The tiredness, the brain fog, the out of breath.
Yeah, and I've definitely gone to my GP complaining of those symptoms to come back with boringly normal iron levels where, I don't have that as an excuse. It's more to do with the
Damn it,
chapter
give me
life.
something to blame.
I know.
Why are women in their 30s and 40s commonly iron deficient, do you think?
So with that, and obviously, there are some women who will have had children, and it may be that the iron is low on the back of that, because we know that pregnancy is a time where we use a lot of iron. It may also be that where if women opt to breastfeed, we have some women who will continue to take a sort of breastfeeding supplement, but a majority of women that I find, after we've delivered, we sort of think, oh, life is too busy. I sort of drop the supplements. And so that is a time where we're using a lot of iron. And so sometimes on the back of that, it can then become hard to try and replace our stores because we're busy using. And when we're thinking about that, that can definitely be a factor.
Yeah, I think that was definitely one for me. It's actually really difficult to take iron tablets regularly, to remember to take them, to make sure you're getting enough, even when you know that they're really important. I would imagine that happens for lots of women who come to see you.
Definitely. One of the tricky things about iron supplementation as well is that it can often have a lot of side effects. And I don't know if you've experienced that, but especially in terms of gut side effects, that probably is one of the biggest reasons that people, including myself, might start off with good intentions and then find that, oh, okay, well, maybe I'm going to hold off my iron supplements for a bit, let my gut get back on track. And then we find that that's something that just sort of ends up sort of going away, or we think, well, okay, I'm going to do this for a couple of months and then hopefully my iron levels will be okay. And then, as you sort of mentioned before, it might be that we're not sort of rechecking and seeing what's happening.
Yeah, I think that's a really common thing that happens. How do you check iron status? What's the first step?
Well, in terms of doing that, normally we're doing a blood test. With that, timing is quite important. So if you've ever looked at your results, you'll find that when we request iron studies, we get a panel. With that, it's got your serum iron, which, to be honest, is useless. Don't look at that for too long. Keep moving. We then have your ferritin, and that's the important thing. So your ferritin is giving us an idea of what your iron stores are. Unfortunately, it can be affected by a few other things. So your ferritin is also what we call an acute phase response protein. So that can be affected by other things that are going on. And especially if you're unwell, then it can be falsely elevated, or if there's inflammation somewhere. So it is helpful for us to have an idea of what your iron is, but it can be falsely raised in some situations.
I did actually put off my blood test this time because I had a cold and I didn't want to pass it on to the person doing my blood test, but I didn't want to get my ferritin levels back and see that they were normal when in fact it was actually in response to illness. So that's a great point. I mean, sometimes it's tricky, isn't it? Because having a blood test is another thing to put on your list of things to do, another thing to prioritize your health. But I would say for most of the time that we need people to have a blood test to tell their iron levels. Why, can we not just supplement it and hope for the best?
Well, I mean, I think with that, it depends on each person individually. Us going off and having a blood test every 3 months isn't necessarily going to be helpful because that's going to take away some of the blood and some of the iron that you need. So it is trying to find a middle ground that works well. With that, that's where having, a GP who you know really well, who can sort of get a good feel for all of the things that are going on is useful. Doing a blood test is helpful for us, but as we've said, the numbers can be affected by other things. So it can be helpful for us to do the blood test in the context of symptoms. If you're tired, then we need to be exploring things. Obviously, we're talking about iron here, but there are other things that can be at play, your thyroid, your calcium. We need to make sure that we're being holistic. With doing blood tests in terms of time frames, that's where it depends on what's going on for the individual. So often what we'll do is, say, for example, you go in, your iron is low, but your hemoglobin is normal. So that's an important thing for us to sort of talk about, that you can have iron deficiency, but then you can also have what's called iron deficiency anemia, and they're not necessarily the same thing. Anemia is where your hemoglobin count, so your red blood cells, are low, and so that is definitely more serious and significant. With iron deficiency, with normal red cells, that's a sort of middle ground. That's where we need to try and get in there quickly, try and supplement some of the iron so that we're not getting to the point of being anemic. And especially during pregnancy, that's where sometimes that can happen because of how much iron we're using during pregnancy. With supplementing, often we review and see where things are at 3 months' time after using iron supplements. And obviously, we'll talk a bit more about iron supplements next. And then it can be helpful for us to see what's happening. Has the iron level come up nicely? Great. The iron level has come up. Let's continue with what we're doing. And we probably do need to continue with that. But also thinking about why you were deficient in the first place. And with that, obviously, as women, periods can be an issue, but not everything is period related. Sometimes we can have issues with gut in terms of absorption. Are we losing iron elsewhere? Are we so busy being active, going to the gym, doing all the things, that we're just using up a lot of iron, and actually our net is lost because we're using up more than we're taking on board? And I think sometimes people can be quite surprised by that idea, when we talk about why is your iron low, that they can be using up so much that even with their wonderful diet, that it's not quite iron rich enough.
Yeah. And you stole the question out of my mouth. So I was going to ask you kind of what else would you be looking at regularly, or looking at if you regularly had low iron? And so those are some of the examples. Is there anything else? I mean, I had a celiac screen at the time.
That comes into the absorption side of things. So with celiac disease, what's happening is the little sort of villi that live on in our small bowel get a bit blunted, and that means that they can't absorb quite so well. And so especially if you've got iron deficiency, often what we'll do on a subsequent blood test is to do the celiac serology blood test. With that, that has a few caveats too. With any blood test, we want to make sure we're doing what we can so that it is helpful for us. And so if we don't have a reasonable amount of gluten in our diet, and typically with that it's the equivalent of 4 slices of bread daily for the last 6 weeks, then you might get a false negative, whereas actually you might have that. So a couple of things to kind of factor in there. Celiac disease is probably one of the better known things. Otherwise, other gut issues, so things like inflammatory bowel conditions, Crohn's, ulcerative colitis, some of those situations where you've got an inflamed bowel is going to affect how well we're able to absorb iron, but also a whole host of other things.
So the long and the short of it, I guess, is that it's not always as simple as just kind of adding more iron into your diet. And there, for lots of women, we really need to unpack the reasons that they might have low iron, or really investigate those kind of potential contributing factors. Would you say?
Yes, definitely. And so with that, I mean, blood donation is also a factor. Obviously, I'm definitely very supporting of people who want to donate blood. It's a wonderful thing to do where you can. But sometimes frequency of donations is something that we need to try and make sure that we're just balancing that, so that you're able to donate blood, but we're making sure that you've got enough of the resources that you need for your body to sort of function well as well. With periods, which is probably one of the most sort of common reasons that we have for iron deficiency, trying to be sort of holistic in terms of what's going on, how heavy are these periods, how long are we bleeding for? With that, I guess it depends on the woman in terms of what the sort of bother factor is. For some people, they're happy to appreciate that their periods maybe are on the heavier side, but would prefer that to other options in the way of sort of hormonal options that we have. We also have non-hormonal tablets that you can take maybe just when you're on your period, things like tranexamic acid or Ponstan, which is a type of anti-inflammatory. that we can use. And then depending on where you are in your sort of journey of fertility and childhood and having sort of periods, for some women, options like endometrial ablation or Marinas are options as well, just to try and really close the, because I try and encourage people to think of it in the way of a bathtub, that if we've got this iron that we're putting in, but we've got the plug that's open, then we're going to be losing this blood. And you sort of, if you've got a point where you've got a reasonable reserve, that's fine, because we can almost compensate. But then if we're losing more than we're putting in, then we're going to get to a point where we sort of drain that resource. So we need to kind of be holistic in terms of the ins and the outs as well.
It makes sense. It's a bit like a jigsaw puzzle in a way, isn't it? That there are all these different pieces you're putting in place to work out kind of where you're having those losses, where it's coming in, and what that balance looks like. Yeah, interesting. So let's move on to our kind of next step then of treating it. If you've kind of worked out, you've had a blood test, your ferritin is low, you're looking into kind of some of these other factors that might be contributing to the low iron. What is the next step in terms of treating iron for the women that you see in your clinic?
Okay, so with that, we normally would aim for oral supplementation. With that, so as long as we don't have anemia, if we've got time, we try and do it through oral resources. So not all iron supplements are equal in terms of the elemental iron content. So we have different types of iron depending on if it's 2+ and 3+, and I won't bore you with the sort of chemistry of it, but there's a really good table that I've sent you a link for, which potentially will be sort of added in with the podcast. But it can really help to kind of break it down, because sometimes when we've got a higher amount of iron that we're getting in with our supplement, so things such as sort of ferrograd C, it is very common that people are going to get side effects from that. So common side effects being abdominal pain, constipation, poo turning black. With that, if we're finding that that is too hard, and also the evidence is suggesting that everyday dosing is okay in terms of the absorption levels that we're sort of getting, then we have the option of maybe dropping the level of elemental iron if we're finding that that's too hard to tolerate. So, for example, multifer syrup, and a lot of people will say, oh, you know what, I found the liquid much easier. The amount of elemental iron in 5 mils, which is what most people would take, is 50 milligrams, which is half the dose of ferrograd C. So with that, if you're finding that that's better, that's great, but we're not going to increase our levels as fast. So some people find multifer too much, in which case, it might be that we use something else. Ferroliquid has about 30 milligrams per 5 mils. So if that's easier for you, then that's great. And then other people, we will use things like Spartone, which has got a much lower level, but we need to kind of make sure that we're getting it in regularly. So saying I'm taking my iron supplements regularly doesn't mean the same thing for everybody. So that's why it's really useful to nut it out, so that we can really be across, well, okay, I can't take the high strength of iron, but that's okay. I'm going to take the lower strength and do it more regularly, and appreciate that it will be a gentle climb, so that, your ferritin will just slowly increase over time.
Yeah. And it's finding that one that works for you, isn't it? Which can take a bit of trial and error, and really working out how low your ferritin actually is and how quickly it needs to come up. There's a lot of things that are going into your considerations when you're making a recommendation for someone.
Yeah, definitely. And, with that, for some people, if our loss is greater than what we're able to sort of put in, coming back to that bath analogy, then that's where it might be that we need to move towards something like the infusion that you had, so that we can fill the bath back up and then work with what we've got. But the same thing.
Keep it in there.
Yeah, to keep it in there. Exactly.
And I guess there's a lot of misinformation about iron out there. Like, there are a lot of multivitamins that contain some kind of iron, or people might tell you, oh, you just need to eat more red meat. Can you talk to kind of the difference between a general supplement and a therapeutic iron supplement? Like, that you actually do need to have a specific dosage calculated, for you?
Yeah. And that's where trying to break it down to a point where we can compare, which is where the elemental iron is helpful, because just because something says that it's 200 milligrams or 300 milligrams, it's not all equal. We've got different types of iron. We've got the, polymaltose. We've got ferrous sulfate. There's all sorts of sort of bits and pieces there. What I would say as a general rule, though, is that if you've got a multivitamin, so something that's got a few different things in one go, the chances are that the amount of iron in it is enough to maintain your level, but it's probably not going to be enough to bring it up in the way that we would like to, especially if you have iron deficiency. So it's not that it's necessarily
staying at the very empty level.
Well, it depends on where your sort of starting point is, but we're not
Sure.
likely to be making much in the way of headway with the rising ferritin with a multivitamin.
Makes sense. Okay, so I had been taking the tablets personally for a while. I was definitely not as consistent as I should have been with them. And when I'd had a subsequent blood test, they were not having the impact that would be ideal. And that's when, in discussion with my GP, we moved towards an iron infusion. Tell us about iron infusions.
So with an iron infusion, what we're doing is we're putting a large amount of iron into your body in one go. The main reason that we're choosing that is because either we're not winning with oral supplementation, or because we've got anemia, or because when we're thinking about timeframes, that the time that we would need to get a rise in ferritin, we don't have that to achieve that with oral supplementation. So with an iron infusion, what we do is, as you would have experienced, we pop the cannula into your arm, so it's going into a blood vessel, and then with that we run the iron through. Generally speaking, most of the time we run it through with saline. At the time of recording, what month are we in? October of 2024, we've got a little bit of an issue in terms of saline and the availability of saline bags. So, it may be that we start to move towards more sort of slow pushes of iron just in its sort of straight form, without it necessarily being diluted. But essentially what happens is, normally we sort of run that through, give that time, we monitor you to make sure that there's no risk of anything in the way of side effects. Some people can have allergic reactions to that. That doesn't always happen the first time, as with anything, because I'm sure you're across with allergies. Sometimes we become sensitized, and then after your third or fourth iron infusion, that's when you have a reaction. We obviously do need to be careful. And iron infusions, generally, we want to try and avoid them as much as we can. But where we need to use them, then they definitely do have a place.
Yeah. Is that something you do at your clinic, or do you refer people out to?
Oh, yes. So in terms of general GP, yes, I do. At FitRight at the moment, we don't have the capacity to do iron infusions there, but it may well be something that changes over time.
Great. Side effects of the infusion.
So in terms of side effects, we've got the sort of big ones that we worry about. So whilst you'd be having an iron infusion, we'd be monitoring you. So checking for any signs of shortness of breath, any changes with your blood pressure, any signs of swelling at the site. The iron is a brown solution, so it's really important that we have a really good vein that we've flushed through to make sure that it's in a good position. Also making sure that we're staying nice and still when you're having the infusion. So especially if it's in your elbow, making sure we're not kind of moving our elbow around and bending there, because there is the risk that the cannula can become misplaced, and then that iron and the brown solution can become exudated, which can leave a permanent brown stain. Which is definitely something that everyone wants to try and avoid happening. Otherwise, more common sort of side effects that people have are that often they can feel quite tired or have flu-like symptoms in the days after their iron infusion. We've sort of called it, associating it with people having, your body suddenly having to deal with all of this iron and suddenly having to pack it all away. But we're becoming a little bit more aware of the effect that iron bulk can have on the body, and especially in the way of phosphate levels, the effect that can have in that.
Let's talk about that phosphate levels, because that has been from my experience, I feel like that's something we're kind of only really learning more about in the past kind of few years. It's kind of cropping up commonly. People I talk to have either had an experience with low phosphate. Someone on my team at work had a really tricky experience with her phosphates kind of post iron infusion. So what does it look like? What do you notice? What are you looking for?
So I guess in terms of symptoms of low phosphate, you can have issues with confusion, irritability, drowsiness. That is really quite severe phosphate deficiency that can cause that. With the sort of middle ground, and as you sort of touched on, it is becoming a more appreciated thing. So in terms of most literature, rates of hypophosphatemia, which is the sort of medical term for low phosphate, has been reported as sort of being maybe between 46 to 75% in sort of more recent literature. But with that, in terms of the number of people that we're testing, in terms of how significant the phosphate level is, I don't think we're there yet. The hospitals are now starting to look at doing bloods, especially in that sort of hospital setting, where they've had someone who's had an iron infusion and repeating it for inpatients, which I guess can be tricky because if we've got other confounding factors that are going on. But in terms of that, I think we know that your phosphate absorption can be affected. The kidneys are also affected, and we have an increased amount of excretion of phosphate following that sort of iron infusion. And so a good place for us to start is to appreciate that we can try and improve phosphate levels. With that, we can try and either be a little bit more casual about it. And to be honest, I think that's the approach that most people take at the moment. I think we were laughing about how, and I think I get a few funny looks when I suggest that people might want to go and have a milkshake or a Coke and a burger around the time of having an iron infusion, mostly because phosphate tablets are quite expensive, but also
So expensive.
We have phosphate in abundance around us. And in terms of, a formal protocol, after a bit of research, I've not been able to find a sort of strict protocol. So it very much is a sort of, let's try and increase with the amount of phosphate that we've got. If that's something that someone is happy to use their diet, because we do have an abundance of phosphate around us. And as I said, I've sent you through a link with quite a good resource in terms of some easy foods that can help us to get a bit of phosphate there. And then we can kind of see where things are at. But I'm hoping that, over the next few years, things start to be formalized a little bit more in terms of appreciating really, how much of a drop in phosphate we're going to have. At the moment, we don't tend to check pre-phosphate levels or post-phosphate levels. But that may be something that starts to kind of change given what we're sort of starting to appreciate now.
Yeah, it's interesting, isn't it? So you're telling me though, in the iron infusion, I need to be really still and not move my body for 30 minutes, and then I get to take myself out for a milkshake and a burger afterwards. Selling me the infusion. There's real benefits for the women out there. I
lots of
will
people
link
love
to the
coming
high.
in. And just having to lie down, closing their eyes, listening to music, not having children scrambling all over them. Yeah, quite therapeutic in a lot of ways.
I will put the link to the high phosphorus foods in the show notes. One of the things that I did have after my infusion was a Coke, which is not my. I actually just don't really love Coke, but there was something really medicinal about that one that I had after the infusion. It felt like I was doing something important from a phosphate level. There are absolutely other foods that you can do. We were talking a little bit about fruit tingles being a product that's quite high in phosphates, but there's also kind of dairy products, milk, particularly some of the high fiber cereals. I think All Bran had a particularly high phosphorus level as well. So in terms of replacing those phosphates, what kind of timeframes are we talking, Artie? When do you need to be kind of more conscious of those foods if you can?
So ideally, in the sort of day and day after of the iron infusion. But otherwise, in terms of what we're knowing with regards to the sort of hormonal effect of that, so it tends to be around the 2-week mark post-infusion, that's when we tend to get maximal sort of excretion of phosphate in the urine. And so, in that 2 weeks, it's probably a good time for us to try and supplement as much as we can. In terms of the types of foods that have phosphate in them, and we do have an abundance with everything that's sort of going around. And I don't want to over medicalize things, because I think everyone's got enough to be thinking about. But in terms of things like the bran cereals that you mentioned, chocolates, nuts, dates, beans, peas, pastries, we've got a variety of foods that are around us. And so in that sort of couple of weeks, or if you can, especially when you first go off and get your iron script, thinking about the phosphate that's in your food, and sort of doing that to preempt it, so that we're not sitting just above the mark, so that we're more likely to be symptomatic. And that's probably why, we haven't got to that point of having a sort of more formal guideline, because the amount of phosphate that some people have in their diet compared to others, may mean that some people are symptomatic, other people aren't symptomatic. For some people, the phosphate might never be an issue for them because they have enough of a buffer. And also with their diet, naturally, they have enough phosphate in there.
It's interesting because my colleague who ended up in hospital with low phosphate levels doesn't eat some of those particularly high phosphate foods. She's kind of dairy free, and another couple of reasons for her own medical reasons. But it's an interesting, I mean, we don't know exactly, but it was really difficult for her to be diagnosed at the time, because it was about 2 weeks after the infusion that these things started to happen. And so she didn't even mention that she'd had an iron infusion 2 weeks ago when she first went to emergency, because she's like, I didn't even think that it was related, and it wasn't until they unpacked some of that stuff. And I've heard a few stories from people along that realm. Obviously, it's not something that's going to happen to everybody, but I do think it is really helpful to be aware and take the steps that you can, and kind of just being conscious that at that 2-week mark, if you do feel unwell, that it's worth kind of mentioning to your doctor.
Yeah, definitely. And I think that appreciation of that it is something that we need to be thinking about a little bit more so is coming through now. So it definitely hasn't been part of mainstream teaching previously, and so not everybody may necessarily have come across it. So I think it's really good to try and increase awareness of that, and try and improve.
This is my second infusion, and I was completely unaware of that previously. So it definitely changes in a fairly short period of time. So good to kind of know, and good to be getting this message out there. When you start to feel better, tell me when I'm ready to kind of have this abundance of energy and clearing of my thinking.
Oh, well, for most people, it tends to be assuming they've not had issues with their phosphate dropping too low at week 2. For most people, it tends to be sort of within the first sort of week to the month, where if iron is the main cause of them being tired, then yes, hopefully those ferritin levels will go up. Most people, we do a blood test at 4 weeks post to sort of see what's going on there. Very occasionally, I've had someone where the ferritin was the same, and obviously that needs further investigation in terms of what's sort of going on there. But for the majority of people, your ferritin will then be in the red zone, but the other end, where it's actually because it's so high, and then it sort of tips down, and then we sort of start to normalize. But what is really important is sort of making sure that whilst we have our bathtub that's got a little bit more in the way of reserve, we do still think about things, because what really, for me is a bit of a heart sink is where we've got someone where we've got this recurrent iron deficiency. They're having iron infusions every year, and if that is something where we honestly cannot make a difference, and unfortunately we have to ride that roller coaster, then so be it. But if we've not explored what we can do to try and level things out, and that really is a big shame.
Absolutely. It's worth looking for a plug, right, for this bathtub, because you want to be able to keep that iron in the body.
Yeah, definitely. And, not everything will fit for every person. Some people, aren't keen on a Mirena. For other people, they're trying to get pregnant. And so in which case, actually they don't want to be taking any of those other medications. But we need to try and do something to figure out what is going on. With women, the general focus tends to be sort of towards periods, but making sure we're thinking about their gut and what might be going on there, if there's any other things that are kind of at play as well.
I love it. It sounds like to me, the way that you think about it is that iron is kind of the red flag. Like, yes, we need to treat those iron levels, but we really need to unpack what it's signaling to us. Like, what else might be lingering? What else might be impacting that woman's quality of life, so that it's not just kind of treating the symptom for a long period of time.
Yeah, because we want to try and make sure that we can try and avoid it where possible. The fact that we've got iron deficiency is a sign that something isn't quite right. What can we do about that? How can we improve that? What works best for the woman as well? Or some men do have iron deficiency, which in itself isn't very common and is concerning that there is something sort of else going on. But we do need to make sure, because obviously women have the additional element of having periods and having babies and doing all the wonderful things that we do as women. But we need to make sure that, yeah, we're sort of being holistic and thinking about it. Yeah.
I love that. So the take home message is, if you're listening and you have any of those symptoms, it is really worth booking in to see your GP, prioritizing your health, getting these blood tests done and kind of working out what's going on. If somebody wanted to come and see you in particular, Dr. Arthee, what are their options to kind of find you and kind of discuss a lot of these things that might be going on for them?
So I'm working at Fit Right on Fridays, and so that's run by our wonderful Taryn and Jess. So it's sort of physio run, and then we've also got a space there where I work there as a sort of women's health centered GP. I get the benefit of having wonderful 45-minute consults, which I absolutely love. It gives us a real chance to really explore what's going on for each person, in terms of not just the sort of biological side of things, but also the psychosocial aspect as well. So, I mean, with iron, maybe that's not so important, but especially with sort of other areas, that can be really helpful for us to kind of explore that. But, in terms of iron, it is such a common issue that I think, being able to feel comfortable to have a chat with your general GP who knows your health really well is so important. But also, for a lot of women where we've got the sandwich generation, busy between kids and parents, that we're making time for ourselves, and just really encouraging people to think about that. It might be that it's not your iron. I guess another thing that I wanted to say was that sometimes, even if it's not officially deficient, so with that's a ferritin of less than 30, often people can be symptomatic where their ferritin is maybe, less than 75, less than 50. And with that, I think the role of increasing the iron in your diet may well be quite helpful and help with some of those symptoms. But yeah, tiredness is obviously a tricky thing where we can have lots of causes, which is a hard one to tease out.
Most of them small people, but yes, definitely a big part of the thing. So thank you so much for taking the time to be on the podcast, to kind of share your expertise. I really hope that it has given people some food for thought, something to kind of get some investigations done if this is something that you think might be happening for you. And I would really encourage you to take the time to make the appointment, to make sure that you talk through a lot of the things. Don't let yourself be fobbed off, just with a short-term treatment. We really want somebody to help you unpack kind of what's going on for you. And it's definitely already made a huge difference for me. I'm about 2.5 weeks post treatment and the infusion, and yeah, I feel a million times better. So there is a light at the end of the tunnel for everyone listening. So thank you again so much for your time. I really appreciate it.
Oh, thanks for having me.
My absolute pleasure.
A huge thanks for tuning in and listening to my podcast. This is all brand new for me, so I'd love to hear your feedback. Give me a review or send me a DM. I'd love to hear your thoughts. And above all, I'd really love you to hit that subscribe button to keep listening. Thanks.